Hi, I'm Lauren Ditta, and I'm a pediatric neuro-ophthalmologist at Bonheur Children's Hospital in Memphis, Tennessee. I'm one of the doctors who's part of the Bonheur Children's Hospital Tuberous Sclerosis Center of Excellence here, and I treat a lot of the children who come to have their tuberous sclerosis treated. As a pediatric neuro-ophthalmologist, I have board certification in ophthalmology, as well as fellowship training in pediatric ophthalmology and neuro-ophthalmology. Today what I'd like to do is answer some of your questions that were posted on our Bonheur Tuberous Sclerosis Facebook page. One of the first questions that we received was, why should my child be evaluated by a neuro-ophthalmologist? And I think the best way to answer this is to think of tuberous sclerosis as a multi-system disease. So we know that tuberous sclerosis affects many different organ systems in the body, particularly the brain and the eye. What many people may not realize is that we see not only with our eye, but also with our brain. The eye is really the window that takes in the visual scene, and then it's the brain that processes that image. And so the neuro-ophthalmologist treats disease processes specifically that deal with the eye and the brain. So for example, if the eye is functioning properly, but there's an issue with the brain and the processing, then someone may complain that the image is not clear. By the same token, if the eye has a problem and can't create a clear image, even if the brain is functioning properly, then the person may still complain that they don't have a clear image. So a neuro-ophthalmologist's role is really to tease out the details between is vision affected because of the eye or the brain. Many times parents will ask me in the clinic, I've seen an outside optometrist, why do I need to see a neuro-ophthalmologist, or is my outside optometrist or eye care provider enough? And I think that's a really great question in today's society where there's so many multi-level providers. Tuberous sclerosis has eye findings. Oftentimes they're not problematic and they don't cause issues with vision, but sometimes they can. And patients with tuberous sclerosis can have brain issues as to why they then may have eye issues. So I think it's really important to have an evaluation by a neuro-ophthalmologist at least once, particularly early in life. That way you as the family can be counseled and educated as to what to expect going forward. Additionally, if your child has an eye finding, then it's very important that you maintain a relationship with their neuro-ophthalmologist over time to make sure that there's no loss of vision. Here's a really good question that we received. Are there any signs or symptoms of the eye that you should be concerned about, and when should you notify the clinic? This is a great one because the ultimate goal for me as a neuro-ophthalmologist is to preserve vision. So in some respects, the job is up to you as the parent, and then other times it's your role to really listen to your child. If you have a preverbal child, then you as the parent need to really be on the lookout for any issues. So some obvious things might be a red eye, drainage from the eye, puffiness of the eyelid, or any redness. Another sign that your child may not see well could be squinting. That could mean that they need glasses. Something else might be if you've never noticed before that their eye turns in or out, or if the eye shakes, could be a sign that they don't see well out of that eye and that it needs to be evaluated for any pathology. Finally, a very obvious thing that we may not think about, but if your child, their visual behavior has changed, so maybe they were really interested in a toy and it just doesn't look like they look at it anymore, or if your child is running into things, walls or TVs, then that certainly is a reason to contact your neuro-ophthalmologist. If you have an older child that can tell you that something's going on, then certainly listen to them. Some things they might say is blurred vision at school, double vision, especially something that's new onset, can be very concerning. Additionally, if they have any eye pain, discharge or redness is another thing that they may comment on that would certainly be needed to alert your neuro-ophthalmologist. Another question that was asked is if your child has a retinal hamartoma, will that lesion get bigger or smaller? So in my experience, and I think it's consistent with the literature, it seems that these lesions do get bigger over time, and there can be new ones that develop over time. There have been case reports where these lesions have regressed and gone away completely, and in other cases there have been reports that lesions get very large and can cause acute loss in vision. But I think for the most part, slowly over time, they do get larger, and there may be more as they get older. One of the most important things that I do as a neuro-ophthalmologist is when a patient comes to see me, I treat the whole patient, not just the lesions. And so one question that was asked is, what is more important, or what could be more vision threatening? The retinal astrocytic hamartomas or other non-retinal findings such as an iris pigmentation change, a sector defect, a coloboma, or strabismus? And really the answer to that question is it could be anything. For example, if your child is very high functioning and they're only identifying pathology on an eye exam is that they need glasses to see the board at school, well then for them that's the most important etiology and most important reason to treat the patient. By the same token, if there's a lesion in the back of the eye that's causing a problem with vision, then we need to address whether there are issues that need to be treated or things that need to be monitored over time. Also, if your child has strabismus, then that may be a totally separate issue that we need to evaluate to make sure that your child doesn't lose vision. It's important to get an eye exam early in life, and then I do think it's important to be monitored over time, even in adulthood, because as I said, lesions can enlarge over time and eye issues can change over time. So it's important to maintain a relationship with your neuro-ophthalmologist. Many of your children may be on an mTOR inhibitor, such as Afinitor or sirolimus. And so one of the questions that was asked, which I think is a great one, is can any of these medications reduce the size of the lesions in the retina? And so there's been new research that has come out that has addressed this question very specifically. In one study, there were patients who had lesions in the brain, so subependymal giant cell astrocytomas, or SAGAs, that were treated with one of these agents, an mTOR inhibitor. And what they found, incidentally, was that the lesions in the retina shrunk during the time course that they were on this medication. So I think it's a good option to have, especially if from a multidisciplinary approach, your child needs to be on this medication. If there are lesions in the retina, it can be something that your neuro-ophthalmologist can monitor over time. So thank you for letting me talk with you today. I hope I answered your questions. If there are any further questions or anything I can do for you from the neuro-ophthalmology clinic, I'm happy to do so.